So let's get started with access. The most accurate way to measure access in hospitals is by way of using discharge rates, so hospital discharges. Hospital discharges are simply defined as the total number of patients released from a hospital's acute care beds during a given period. Now, you might say, why not measure hospital usage, particularly access, by counting hospital admissions? Unfortunately, hospital admission rates is not accurate because there are some people that may not be counted in admission rates. And a perfect example would be babies that were born in the hospital. So whoever is admitted is the mother, and at that time the baby is not born yet, so is therefore not recorded as having been admitted. But if we count discharges, that will then include the babies. Also, please remember that deaths that happen in the hospital are also counted as discharges. Now, hospital discharges are expressed as a rate, and therefore you use per 1,000 population. So discharges per 1,000 population. So let's take a look at this. As an example, County A has a population of 100,000 and has 3 hospitals. So there were 200 patients discharged in a 30-day period, which is a month. So you divide this by 1,000 population, and therefore County A's last monthly hospital discharge rate is 0.2. Now, this period could change. This could be an annual basis, for instance. There are hospital discharge rates which could go up to as much as 5.2, something like that, because obviously it's a longer period that's being measured. Now, let's look at utilization. Utilization of hospital services is measured by inpatient days. So inpatient days is strictly defined as a night spent in the hospital by a patient. So if I were admitted in the morning and I was sent home late at night before midnight, that is technically not an inpatient day because I did not spend overnight. Likewise, if you go into the emergency room, say at 10 p.m., you didn't get seen until 3 a.m. and then they actually sent you home, that also wouldn't count as an inpatient day because there was no formal hospital admission done. Now, average length of stay is also a measure wherein we take the average number of inpatient days a patient spends in the hospital. So let's take a look at this example. So patient 1's inpatient days is 5, patient 2 is 3, patient 3 is 6, and patient 4's inpatient days is 4. So what would be the average length of stay for these 4 patients taken all together? So you take the sum of these, which is 18, sum of all inpatient days, divided by the number of patients. And the answer would be 4.5 average length of stay. Now, the average length of stay in the United States is roughly about 4.8, close to 5 days. We have seen sharp declines in average length of stays in hospitals because there has been the growth of alternative services such as home health, subacute long-term care, and people not really being formally admitted because they go into a recovery room. So we're talking about same-day surgeries, for instance. They will get admitted in the morning, and then they would, the surgery probably doesn't take a long time. It could be something that may just take a few hours. So by around 10 a.m., the patient is already in the recovery room, and by the end of the day, the patient can actually be sent home. And then again, this is also made possible by the advancement in medical technology. There is also no evidence that quicker discharges from hospitals are harming patients. So that's actually a perfect example of cost effectiveness. Now let's talk about capacity, capacity in relation to access utilization. Capacity is defined as the number of beds set up, staffed, and made available by a hospital for inpatient use. The key word here is staff, meaning there are assigned nurses for that bed, as well as other healthcare providers. 84% of community hospitals in the United States have fewer than 300 beds. So if you think about the community hospitals that are owned by the city of New York, let's think about Harlem Hospital or Metropolitan Hospital. Those are actually not very big hospitals. On average, they have about 300 beds. Surge capacity is something else that we look at, but this is more as a response for after 9/11 and also right after post-Hurricane Katrina, where there was a public health disaster and there was an increased need for hospitalizations. And hospitals were not ready to take in patients more than the capacity that they have, the number of beds that they have. So hospitals actually need to have an emergency plan where they should have surge capacity in case of public health disasters. They should be able to accept people. Like, remember during the time of the swine flu incident here in New York. Now, census is the number of patients on any given day. So, example, let's look at this data on census that's out here. So, these are census on any given day, and we're looking at a 7-day period. So, if hospital 1 has capacity of 200 beds, they were actually not able to fill it up. They were only filling up this much beds. So patient days or days of care would be cumulative census. What does that mean? That means if you add up all of these, that would be the cumulative census or patient days of care. And that result would be, the number is 960. Now the average daily census is patient days in a given period divided by that days in that period. So how will that go? So let's look at this example. 960, right? So that's the patient days in a given period, 7-day period, divided by the days in that period. And in this case, we have 7 days. So therefore, 960 divided by 7 is the average daily census for hospital 1 in a 7-day period. And that would be 137. Now, occupancy rate is the percentage of capacity utilized during a defined period of time. And this is derived by dividing the average daily census for that period by the capacity. So going back, the average daily census of hospital 1, and then its capacity, and we said the capacity is 200 acute care beds. So 137 divided by 200 is 69% on a 7-day period, meaning the occupancy rate of that hospital is even less than 70%. We already took notice of that when we were looking at the daily census. We were saying that on any given day, they're not even filling up all their beds. So if you take an average and you do an occupancy rate, it will show 69%. In terms of access and utilization, these are all related. These are all interrelated. And if you look at this demographic characteristics, it's pretty much self-explanatory. The elderly tend to have more chronic conditions that require acute care hospitalizations. Women tend to be admitted more to hospitals primarily because of childbirth. And then we also know that this three seem to have an association, and they tend to have higher utilization in terms of acute care.